All right. So we're going to move on, even though we are having a tech issue in one of our centers. And I do have my scrubs on tonight. I'm just wearing a sweater over them because I'm chilly. All right. So week 8, guys, there's only 2 more weeks left. Isn't that fantastic? Yay! I know. Everybody's doing really well keeping up with things, and I'm thrilled. This is our 2nd week of radiology. So we have 1 more week next week of radiology. And we'll also be working on resumes and cover letters next week. So I know that a lot of us are like, oh, resumes, cover letters. But we want to tailor them to dental. So that should be new to everybody. All right. So even though you may think you've got a beautiful resume, we just want to shove some dental into it and make it even prettier. All right. So the resume is required for getting your certificate, so you have to send one into the school in order to get your certificate. So it is still an important part of making sure that you're doing all your things. But we'll wrap radiology up next week, so that's a good thing. Yes, and then we only have 1 class after that, and that will be in January. So you have a couple weeks of catch-up time. To get your exams completed, do some reading, things like that. Take some time off for holidays, Yeah, it's a great time of year, isn't it? Yep. All right, so the first thing that I would like to start with is a couple questions, and in no particular order. I am going to... It's so funny because I can hear them and see them, but they can't see me. Can anybody tell me why dental x-rays are needed? How would you explain to a patient? What are you going to say to them when they say, why do I need to have x-rays taken? Anybody want to jump in? Good, go for it. Yep.
Is it to just when... How do I want to word
this? That's exactly how you're going to feel when you have a patient asking you to. You will.
Is it to... Sorry, could you say the question again?
So
I apologize.
Why are dental x-rays needed? Why do I need these?
Can I go?
Sure. All right, Francis is going to jump in. Go for it.
I think that the x-rays are taken so that the dentist can see, cavities and other things that may need work.
Okay. All right. Good. So I like the start of that. Can anybody expand on the last part maybe that we're missing? So Francis said that the dentist needs to be able to see the cavities and anything that may need work. And we can also follow that up by saying that there are so many conditions that are not visible in the mouth. Okay. And that x-rays allow us to see things that we cannot see by looking with our eyes. So most of the dental conditions that happen in the mouth can't be seen with the naked eye. And so that's why we want to justify what we do to our patients. Sound good?
Yeah, it does.
All right. And if you have questions about what I'm yakking about when we go through this, just send up a flag. All right. Who discovered x-rays? Here's an easy one. Crickets. I ask an easy question and I get
R.
R.
I
just
have a problem with pronouncing it.
You are not the only one. Sarah, tell her how to say it because you said it earlier.
Röntgen.
Good. Röntgen. All right. So,
yeah.
I want to say like Redken, like the hair product for some reason.
Yeah, that's not bad. And I always think about it like pay the rent. Right, so pay the Röntgen. Yep. So even though it looks like Röntgen, it's typically pronounced Röntgen. Yep. Very nice. All right. Let's see. How fast do X-rays travel?
The speed of light.
Oh yeah, that's a good one. All right. Speed of light is correct. Okay. Somebody tell me which orbital shell has the highest binding energy in an atom.
Electrons?
Yeah. No. So which shell holds those electrons on the tightest?
K. Wait.
K. Yes.
Good job. Yeah.
Yeah.
Sorry.
Yep.
Without
So
even,
K is correct. Yep. All right. And let's see. Where am I going next? What is the name for the harmful effect of dental x-rays? What is that word that talks about what x-rays do to atoms?
ionization.
Ionization. Very good. Yes. Excellent. Okay, let's see. All right. So if an atom loses an electron, what's its charge now?
And
Negative.
It lost a negative. So what's it going to be now?
it's positive.
It's positive. So when an atom is ionized and it loses an electron, the remaining ion is positive.
Okay.
Because it lost a negative. So it becomes a positive. That sounds an awful lot like math and algebra, I know. So if nothing else, just absorb it. Let it memorize. Let's see. Okay. Somebody tell me what the MPD is for an occupationally exposed person like you or me taking x-rays. What's the MPD? Give it to me. One person give it to me in REMS.
0.05. Wait, 5.
Who said 5?
I did.
Okay, yeah. So 5 REMS. And what's
Yeah.
the sieverts? Somebody give me sieverts.
0.001. I mean 0.005.
5.
1 less 0. So it's 0.05 sieverts or 5 REMS.
Oh, it's kind of like
Yep.
percentage.
Mm-hmm. 0.05 sieverts or 5 REMS. And that's a great way to think about it. Kind of like percentage. Yep. Okay. Let's see. No, don't be lost. Okay. Can anybody tell me what a film badge is or a pocket dosimeter?
It's to people in the laboratory use this to detect radiation at
Who
work.
wears it? Good. At work.
Us workers.
So we wear it. Yes,
Yeah.
exactly. Very nice. Very nice. All right. I got just a couple more, and then we will get into new stuff here. Let's see. Okay. The X-ray won't stay in place. Can I hold it?
No.
No.
Okay. Who should hold it?
The patient.
Okay.
No.
That's fine. The patient. So what if the patient can't hold it?
Then if they require an assistant, when whoever's assisting, like if it's a child, wouldn't it
Okay.
be like the adult in the chair? Or is it those clip things that hook into your mouth that hold it?
Good. So it's either the parent or a caregiver. So whoever is the responsible person with that patient is going to do it. Just remember, it's not us. That dental assistants you never hold the film for anybody. Your job is to push the button, not hold the film. You good?
Yeah.
Yeah?
Yeah.
Okay.
Push the button.
Good. Just push the button. Okay. Let's see. Okay, what does the aluminum filter do? What's the function of that aluminum filter in the machine? I'll make some motions here.
It shortens the wavelength of the electromagnetic pulse. Like it's hard to explain. Trying to explain it. It
Okay.
basically shortens the
So-
wavelength, heightens the energy of it, and directs
All right.
it. Like
So what's it filtering out? It's taking out the long and low, and it's
And
leaving
incre-
behind The short,
short
and high.
high.
Yep. So you said it right, but we just want to make sure that that all of us are understanding that the aluminum filter, like if I were to put a filter on my water faucet, what's it filtering out? Junk.
Impurities.
Yes.
Impurities. So what's my junk in an X-ray? Anything that is long and low. Yep. So we don't like them long and low, ladies. We like them short and high. Sometimes you have to make jokes to be able to remember it. Trust me. It's the way it's got to be. All right. Let's see. What does the MA control in the machine? So in the little tube where all of the X-rays are made, if I turn my MA up or down, what do I get more or less of?
Contrast?
Mm-hmm.
No.
That what you're saying controls the image. Think about the actual machine. So who are those guys having a party in my machine?
Oh.
I can't think.
Anybody else? Tony, you got me? PVAC, you got me? No? Okay, so the electrons. So MA controls the number of the electrons that are having a party.
Okay.
And then what does KVP do?
What is KVP? Sorry.
What is KVP? Tells those electrons how fast to go across the inside of the tube.
Oh.
Tells them how quickly they're going to move from the negative side of the tube to the positive side of the tube. What happens when they get to the positive side of the tube? They slam into the tungsten target and they become X-rays.
X-rays?
Yep. So that's getting into the toaster again. That's like, how does this toaster work? It makes electrons, they go fast, they hit the tube, they make X-rays.
Wow.
That is a place that we can come back to and review next week. All right?
So the KVP
ahead.
controls the speed of the electron through the tube?
Yes. Yep.
Okay.
Good. Mm-hmm. Because otherwise they don't know how, like, if you use the analogy of the electrons having a party in there, they don't know how fast to dance
Okay.
unless the KVP tells them. All right? Does that make, like, if you're thinking of it that way?
Mhm.
So that's one way. Courtney, can you hear us now? Nope, she can't. Oh, that is a bummer. Okay. All right. Differences between shades of gray on an X-ray. What do we call this?
Radiolucent and radiopaque.
Okay, those are the two. What is radiolucent? What does that mean on an X-ray? What color is it?
Black.
Black.
Yeah, black. Okay.
Yep. Because it has the L, radiolucent. That's black. What
Yeah.
about radiopaque?
White.
Good.
Yeah.
Radiopaque ends in an E, so it's white. Okay. And what about the range of shades of gray in between them? What do we call this? Has a name.
Oh.
Oh.
Compare and
Contrast.
contrast. All right. So contrast is the range of shades of gray from black to white. All right. It's how two things look different from each other in black and white. All right. What if my film is overall too dark? What do I say? It has high what? It's harder than it looks, isn't it?
Radio.
Density, high density. All right. So we will come back to those next week. So that's all from the machine characteristics one. The first one you guys did awesome on. So we're just going to work on our machine a little bit next week. Okay. So now we will move into today's fun. Okay. Can everybody see? Courtney, can you hear us yet? No, she's still waiting. Okay. So we are working today on the types of dental images that we take. And this is called intraoral views. Now, before we get into this lesson, I want you to sort of put in perspective what we just talked about. So on the job, you will almost never answer any question about the machine, answer any question about like all of the things that we stumbled on about atoms and things like that. You won't answer those questions. Those are your questions for RHS. So the on-the-job stuff is how you do it. And taking x-rays is not that hard. All right. So it's more a matter of understanding the processes that we use to take the x-ray when you're working. But how do you get there? You got to memorize all that other crap so that you can pass the test to get there. All right. So keep it separate in your head. So if you're feeling frustrated with radiology, if you're feeling like, wow, I don't get this, I don't understand, that is so normal. All right. And it is like, I can't even tell you how many years I spent in that space. All right. So that's normal to feel that way. So tonight we're going to look at some of the hows of taking x-rays. And we're going to start with identifying the types of sensors and the 3 types of intraoral views. All right. And so there are 2 types of sensors that we use. We call them image receptors. And we talked about this last week, and I think everybody's kind of there on this one. Either you are using old style film or you are using a digital sensor that's hooked up to a computer. 2 ways to do it. Can I get a show of hands? And I'm just going to shut this off so I can actually see your hands. How many have had digital x-rays taken that you're aware of? Okay. Sarah has. All right. Couple, and my Stephanies have. Yes. Good. Okay. Mel's good. All right. So everybody else has had film? Is that? Mm-hmm. Yeah. Okay. And
Yep.
Okay. So there are 2 ways to do it. Either we do it with the film, which is the old way, or we do it with the digital sensor. Most offices have moved to digital. Guess who hasn't? And I'm sure you can guess, are places where technology hasn't completely infiltrated yet, which are places like Maine, which is wonderful in my eyes because I'd rather use film all day long. Yeah. So I'm an old school chick. But there are 2 ways to do it, and we've got to understand that whether you've got film in the patient's mouth or you have a digital sensor in the patient's mouth, the procedures are the same. You're doing the same thing. So it doesn't matter. So we have to learn about both film and digital, but tonight's procedures are all the same regardless of which one we're using. So there are 3 types of intraoral projections or views that we take in the mouth. And they are periapical, bite wing, and occlusal. And we're going to look at these. All right. So a periapical, and I have some follow-alongs if you have your text and you want to follow me. So a periapical shows maxillary or mandibular teeth in the same film, but not both. So you either have or, but you don't have both. You have either uppers or lowers. And it shows the whole tooth crown to root. And we don't say periapical all that much in the office. We say PA. So I will say to my dental assistant, or a doctor will say to the dental assistant, take a PA on the lower right for me. And this is what you will produce. All right. And this is actually a molar PA. It's a very beautiful x-ray of the 3 molars that are located on the lower right for this patient. Periapicals show, like we said, the entire tooth crown to root, and they also show 2 to 3 millimeters of bone beyond the apex. And remember, the apex is
The area of...
tip of the root.
Okay.
So the apex is the very tip of the root here. So what we need to see in an x-ray, and you can see that clearly we see this in most of this, is at least 2 to 3 millimeters, which is about, it's less than a quarter inch. So it's a really small, 2 to 3 millimeters is a small amount of bone that we're looking for. But the point is, you can't take an x-ray, or well, you will take many, but a good x-ray shows the tip of the root and the bone beyond it. Okay? So if it cuts off the tip of the root, it's got to be retaken. It's not a good x-ray. All right? So what do we use these for in dentistry? We use them to diagnose pathology of the tooth, the root, or the bone. We use them to find out information about how the tooth is forming or eruption. And we use them for oral surgery and endodontics. Anybody remember what endodontics is?
Yeah.
Endodontics is root canal. All right. So these are the type of x-rays taken when we need to really see that bone. So this is an upper right PA. And I just want to show you here. Do you see this radiolucent area around the tip of this root?
I do.
This is an abscess.
Oh.
All right. So one of the reasons that we take an x-ray like this is to see abscesses at the tip of the root, to
What
see
is
if
that?
there's, so that's infection.
Oh, okay.
It's filled with pus. And yep. And so the patient will likely need either a root canal or an extraction here. And yep. So this is how we determine that. And doesn't want to. Okay. Yeah, I think I went too fast. Did I go? Okay. So the next type of film is the bite wing. The bite wing, or BWX as we abbreviate it, shows both the maxillary and the mandibular teeth in the same film.
Okay.
So there's a visual difference to a periapical and a bite wing. So a bite wing has both uppers and lowers. All right. And we call it a bite wing because the patient is biting down. Oh, sorry. That went too fast. Is biting down on a tab or something. So they're biting down on a little wing. And we get to see both the upper and the lower teeth in the same film. So this shows the crowns of the teeth, but not the tip of the root. It looks at something different than the periapical looks at. And when we take a horizontal bite wing, the long side of the film goes side to side, and the short side of the film goes up and down. All right. This is a left molar bite wing that we're looking at here. Okay. They can be horizontal or vertical, so we can turn the film around and get a little bit more information about the bone, but still see the upper and the lower teeth in the same film. So this is called a vertical bite wing, and this one's a horizontal bite wing. And it all has to do with how we orient the film in the patient's mouth. Are we putting the long side up and down, or are we putting the long side side to side? All right. The reason we take these is commonly for periodontal patients. And you can see if you look here at this bite wing, the patient does not have much bone around these teeth. The bone is way up here. It should be way down here. So this is a periodontal condition that helps us look. So bite wings are taken so that we can see interproximal decay, early periodontal disease, recurrent decay, and how well fillings and crowns fit. What we're looking at when we look at a bite wing are the in between the teeth and the level of the bone right here. So this is called crestal bone because it is the tip of the crest. And we talked about this back in anatomy, back in week 2. Oh my gosh, that was so long ago, right? So nobody ever told you 6 weeks would cram that much information in your head, right? So the bone is like a wave in between the teeth, and the tip of it is called the crest. All right. So we use bite wings to see the crestal bone. And if you look here, do you see this little gray blip in the tooth?
Yes.
This radiolucency here is decay.
Okay.
So I can tell from this x-ray that this patient has a cavity right there. Now it takes a while to get dental eyes that actually pick these things up. So when you first begin looking at x-rays, everything looks black and white and gray and you have no idea what you're looking at. All right. But as you get better at looking at them, you're going to be able to see these small changes that dentists are trained to see. And remember, the good news about being the dental assistant, you do not have to diagnose it. And you never want to tell the patient that that's what you see. But in your mind, you'll be able to think ahead because of what you can see on the film.
Right, yeah.
So I know when I see this that the dentist is going to want me to get out the instruments for restoring it at some point, whether it's today or the next time the patient comes in. That's what tells me what's what. All right. The last type of film that we take inside the mouth is an occlusal view. And this is the easiest film to take. We take it on children more than we take it on anybody else because it is so easy. And the patient is going to bite on the film like a wafer. So they don't have to have it inside their mouth so much. It's really just in between their teeth. And then the PID either is placed at their nose or at their chin. And one of the reasons that we take occlusals is to see where the secondary teeth are. But the main reason we take them is after trauma. So kids fall off bikes. Kids hit their teeth on coffee tables. Kids get hit in the mouth with baseballs. Now, adults get all of these things too, but children get them more often because they have not learned yet how to avoid those accidents that we learn as we get older. Adults get in bar fights. Then we have to do these for adults. All right. But this is one of the easiest ways to take a film of a patient without causing much discomfort to the patient, which is why they're great for kids. So when I say that the angle of the PID is at -35 if I'm taking a mandibular, or at +65 if I'm taking a maxillary, my hope is you're confused. What? But what I want you to know is that on the tube head of the dental machine are numbers. And the numbers indicate the angle that the PID is angled at. And vertical angles either point towards the floor, which make them negative, or they point towards the sky, which make them positive. So this machine right here is pointing towards the floor. And can you see where the indicator is? It's at 60. So we call this a -60 angle because it's pointing down and it's at 60. So here's where we're going to blow your mind. The horizon is flat, right?
Yep.
That's a 0 angle.
Okay.
So when the tube head is flat, the indicator will say 0.
Okay.
All right? When it is pointing either down or up, it's going to have a number value to it.
Okay.
So this machine is pointing down, just like that one is, but this one's only pointing down how many degrees?
10 degrees.
10 degrees. So this is a -10 angle. This machine's at a -60 angle. Now, if I were to take it and point it up, if you can see right here, it starts over again. It goes 10, 20, 30,
Okay.
all right? But then it's positive, not negative, because it's pointing up,
Okay.
all right? So we're going to come back to this. I just wanted to introduce it because you can see how they talk about how we aim the PID in dentistry is discussed in angles, all right? Which makes everyone cry. So tonight, last week, algebra, this week, geometry. Hey, I know, I'm very popular tonight. So we take different shots of both the mandibular and the maxillary with the occlusal. And we've got the mandibular occlusal, which gives an x-ray that looks like this. So it shows the jaw all by itself. And the patient is biting on the wafer. The PID is pointed at their chin. And the angle is set for -55. If we're taking a maxillary occlusal, topographic, this is the image we get. the PID is pointing this way, and the angle is set for plus 65. Okay? Which will lead me to believe that I just completely taught you wrong. Ugh. Sometimes I hate being blonde. Negative 55. Notice how this is pointing. Where's it pointing, guys?
Up.
Up. Negative angles point up, positive ones point down. I think I said it different ways.
Yeah, you did.
I did. Sorry. All right, so.
Negative is
Yeah.
actually positive.
Yeah.
Going up.
Yep. Oh, that's not good.
That's okay.
My apologies. You'll get it. I promise. It's just, it's tough stuff. So if I'm taking a cross sectional of the mandible like this, you can see that the patient is biting on the wafer. That's the film.
So positive is now down.
So, yeah, who's an idiot? Negative is up, and positive is down.
Okay. Is
Yeah, sorry. I feel really bad about that because it's really hard to erase what you first heard. So I'm gonna have to keep saying it. So negative up, positive down.
Thank you.
Thank you for bearing with me. So here, this is pointing up, and notice we've got a 90-degree angle to this. The patient is really laid out for an X-ray like this.
Okay.
All right. If I'm taking a lateral of the upper jaw, I've got the PID pointing down, so it's positive, and it's 60 degrees, just like it was here.
Okay.
All right. So this is pointing down and 60, and that's positive, right?
Yes.
Pointing up is negative.
Yes, it is.
Ugh. Okay. And so here's an example of a few of the different views that we can see. So the first row down shows pediatric of both the upper and the lower. And you see this here?
Yes.
These are the permanent teeth, and these are the primary teeth. And so this gives a really, when mom says, where are her permanent upper teeth? She's 10 years old. She still doesn't have them yet. All right. Because sometimes kids are slower than we want them to be with teeth. Where are they? They're there, Mom. They'll come down when they're ready. All right. But we have to take an x-ray to know that they're there because we can't see them either. All right. So we're not magic. We just know how to use our tools. And then the topographic shows us sort of the whole jaw. You see, on the upper and the lower. Cross-sectional shows us the jaw together, sort of like soft tissue down here. So like what I'm looking at here, this big black space is where your tongue is.
Yes.
And the floor of the mouth. So if somebody got, say, a piece of metal embedded in their tongue, why would anybody do that? For all you piercing people out there.
Oh, yeah.
All right. So if your tongue is pierced, if I take this kind of X-ray, I'm going to see that piercing right there. All right. So yeah, I know, because the way I say it, like, who would ever get a piece of, oh my gosh, you got a piece of metal in your tongue? That's awful. But if I say, oh, I got a piercing, people are like, that's cool. Yeah, no. So that ruins teeth, by the way. There's my position on that.
Yes, it does.
Yep. So, and then this is the maxillary lateral. And this allows me to see from the side. So what I'm looking at here is the patient's sinus. This is their sinus. So if they have a really bad cold, this could be filled up with stuff. And I could see that stuff as grayness on the x-ray. And I could say, you have a sinus infection. Here's some antibiotics.
Kelly,
Yes.
that's exactly what happened to me. Actually, funny story. The dentist.
Tell us about
my
it.
dentist. I got, x-rays and whatnot, and I was laying there, and she's like, huh, are you an uncomfortable person? And I was like, right now, maybe. And she's like, oh, no, because you see that line that's literally going through, looks like it was going through my lip? She's like, that's your sinuses. They sit abnormally low. She's like, you must be extremely uncomfortable. I was like,
Really?
yeah.
Huh.
Yeah, it was really funny.
Nice. Yep, it is,
Yeah.
and that's exactly what we use it for. Yep, that's cool. Not for you, but yeah.
What about
It's
the,
okay, I'll live.
The what?
the C one?
Uh,
What's up with the teeth there?
which one? This one?
Yeah, so yeah, this one there.
This one here?
Yeah.
So this actually is most likely an impacted canine. It's a very good question.
wow.
So a lot of times an impaction, especially with the anterior teeth, we can see them taking a film like this.
Okay.
And I can tell whether it is on the lingual or on the buccal. If I take another film, I can compare it. So
Okay.
good question.
Yeah, that looks
Alright.
weird.
Yeah, so here is the typical, just a review of the positioning. So if the PID is pointing downward,
Mhm.
what is it?
Negative.
Negative. And if it's pointing upward,
Positive.
positive. All right? Am I right there?
Yes.
Okay. One of those facts you just have to memorize. And this down here, this film shows a salivary stone. So you know you've heard people get kidney stones. Well, you can actually get stones in your salivary glands as well.
How?
And this is pretty painful. And this topographic shows me the salivary stone, and you can see the tongue here.
Yep.
See how it looks gray?
Yeah.
And that will tell the surgeon where they need to go to help remove that stone for the patient.
Wow.
Yep.
That looks painful.
Yep. And then if you look up here, you can see there's an abscess
Mhm.
at the top of this tooth.
Yeah.
Abscesses are typically black and round. And that's how I know that that's an abscess. Notice the barrier that's been put over the PID here. So in many offices, you will barrier this so you don't have to wipe it,
Okay.
which is an infection control thing. All right. So when people come to the dentist, especially for the first time, we typically need to do a full mouth set of x-rays. All right. And the full mouth x-ray is usually done every 5 years and typically taken on a new patient. So if I'm a new patient today, I get my full mouth set of x-rays. I don't need another one for 5 years. I may need some checkup films in between that time, but I'm not going to need all of them at once. Okay. So here is an example of a digital survey. And DEXIS is one of the digital programs that is very popular for digital x-rays. All right. And so what are the two projections that we use? They are, anybody? So what shows the whole tooth, crown to root, and some of the bone? This is the periapical.
Yes.
All right. And what shows both upper and lower teeth in the same film?
Bite wing.
Bite wing. Good. So there are only two types of films in a full set of x-rays. So if you look at this full set of x-rays, you're like, that's a lot of x-rays,
Yeah,
right?
it is.
But there's only two types being taken, and it is our job to take them in an orderly sequence so that we don't take one tooth more than once, all right? So that we see the whole person on the full set of x-rays, all right? Just for some interest here, this is a root canal. So you can see how this
That's
tooth...
been done?
Yep.
Yeah.
So this tooth has some filling material in its roots. That's a root canal. This is how a crown looks on an x-ray right here. This is a silver filling. This is a white filling.
Composite.
Yep. And look at this.
Abscess.
Big abscess, right?
Yeah.
Big abscess there. Root canals that have been done
Nice.
on the patient. And then how about this right here?
Oh, that's a cavity.
Yes, that's a big cavity.
Yeah, it is.
All right, so very large cavity on that tooth. And then you can see the fillings. And if you look at this filling real close, you can see that there's a base under here. All right, so we learned about the fact that we mix dental materials to be put underneath fillings to protect the nerve. Well, you can actually see those on x-ray.
Oh, that's
All right,
cool.
so this kind of is the reason why we wait so long to talk about radiology. So it's not because we want you to be so tired of going to school that now you have to learn radiology. It's because you need to understand a lot of the other stuff about dentistry before you get here. All right, so that's part of it. All right, so how the heck do we know what we're doing? Well, we take them with certain teeth that have to be in each exposure. So there are prescribed placements for these x-rays. So every time you sit down in a chair to have a full set of x-rays taken, the person taking the x-rays knows exactly where they're going to put those films in your mouth. All right? Your mouth may not look the same as everybody else's, and you might be missing teeth, but it doesn't matter because those films are going to go the same place on you that they go on everybody else. All right? It just, what's different about them is what they show. Okay? So, I just want you to compare and contrast. This is an anterior PA. These are posterior PAs. So, what's different about the posterior PAs compared to the anterior PA?
They look more natural.
The biggest difference is that anteriors are placed vertically
Oh, okay.
and posteriors are placed horizontally.
Okay.
You see that? So the film, the size is the same, but we've turned it for the back teeth, and we do it straight up and down for the front teeth.
Okay.
And that's because we're more narrow in the front, and we have more room in the back. So I can put the wide side on the back a little bit. This right here, these are permanent teeth that are pushing these baby teeth out.
Oh, okay.
Isn't that cool?
Yeah.
All right, so it's a neat little way of seeing
Cute.
what actually happens when a tooth is loosening and getting ready to fall out on a child. So, yep, and these are posts and root canals. Here's an abscess, all kinds of good stuff, right?
Yeah.
Okay, so now compare the periapicals, and these are anterior periapicals here. And I can tell this because the teeth look like chiclets, not like monsters.
Right.
All right. And what kind of film is this?
Bite wing.
This is the bite wing. This has the upper and the lower in the same film. All right. So when you look at the film, the first thing that you want to do is identify, is it front or back? And is it bite wing or periapical? All right, so those are the two things. Usually I divide them into periapicals and bite wings, and then I say, is it front or back? All right, so here's how a full set of x-rays goes. We want to see the canine, the centrals and laterals, and the other centrals and laterals in canine. Oop, sorry, touchy thing. Maybe I move it too much. I don't know. We want to see the premolars and the molars. The premolars and the molars in bite wing form. The premolars and the molars on the bottom. Premolar, molar. Premolar, molar in bite wing form. Premolar, molar. All right. So it's going to be canine, centrolateral, canine, all the time. And it's going to be premolar, molar, all the time. All right. And we're going to keep looking at them. This is a nicer survey than that one because it has a little bit more of the proper placement. Okay. So this is a full mouth set of x-rays. There are 8 anterior films in this survey. So in this one, how many are there? In the anterior, only 6. And this is because we have changed the size of the film. These are smaller in this survey, so I need more of them to get the pictures to see. We're going to talk about film sizes next week. All right? So right now our goal is to just understand the survey in general. So what size films are being used for the posterior periapical and the bite wings? So all of these size films are the same. The ones in the posterior, they're all the same size. These are called size 2.
Okay.
These that are in the anterior are called size 1.
Okay.
All right. So size 1's a little smaller. We have zeros too. Zeros are used for munchkins for little kids. How many periapicals are there? Now we have to count, right? So is this a periapical?
No.
Okay. Periapical?
No.
Yeah.
It is?
Yep.
Oh,
So
they
both
are.
of these are periapicals. So there's 2. How many here?
2.
2,
2.
2,
And 2.
2. So far I'm up to 8
8. Yes.
periapical, 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 periapical. I got 4 more.
12.
12, 13, 14, 15, 16. So there are 16 periapicals. How many bite wings?
2, 3, 4.
Yep, only 4. All right. So there are 4 of the bite wings. Okay. What size films are being used for the anterior? We said size 1s, right?
Okay, yes.
How many anteriors are there again?
So there are 8.
8 of them. Good. And how many posterior periapicals?
Posterior.
1, 2, 3, 4.
8.
Good. Yep. So this is how you keep looking at these, is to get a sense of how many of each are there. And RHS does like to ask us about how many. All right. So there are some practice things that I'm going to recommend that you guys do. So have no fear. All right. You will practice. Okay. So now let's look at these films and try and identify where in the mouth they are so that we get used to looking at what on earth are these things. All right. So this film right here has a part of one tooth. I don't count the part of. I only count the ones that I can see fully. All right. So it's got a premolar and a premolar and a molar and a molar. This is a premolar film on the upper. And I know it's upper because I can see the sinus.
Okay.
And you don't have sinuses on your lower. You only have them up here.
Mm-hmm.
All right. So that's how I use my anatomy to know where I am. So a good premolar film shows me some of the canine too. Because if I have the canine, I definitely have all of the premolars. All right. And the same here. What kind of film is this?
Bite wing.
Bite wing. And it has premolars in it. So this is a premolar bite wing. Got both of them in it. Now this one only has one of the premolars. So I don't count it because it's only got half. So what kind of film do you think this is?
Posterior.
Yep.
Periapical.
Good. This is a posterior PA, and this is a molar shot.
Okay.
All right. So this is a molar shot. This is a premolar shot.
How do you
See
know?
the difference? Because I've got both my premolars in this shot,
Mm-hmm.
but not in this one.
Okay.
All right. And I know from practice, and you will eventually know from practice. Yep.
Okay.
So when you look at this bite wing, is this a molar bite wing or a premolar bite wing?
I think it's a molar bite wing.
I think you might be right. Yeah. So what I know by looking at this is if they meant to take a premolar bite wing, they missed a piece.
Mm-hmm.
But if they meant to take a molar bite wing, they did pretty well.
They did.
All right. So I don't know without the other films which one this is. Does that make sense?
Yes.
I would have to see the other bite wing to say.
It's like putting a puzzle together.
It is exactly like putting a puzzle together. If you like puzzles, you'll love mounting x-rays.
Mm.
How many people like puzzles?
I do.
I do. All right. How about this here? What are we looking at there? Sorry, that thing has to go away first. Okay. So what do you think you have there?
Which one?
And
This one down here.
it's an anterior maxillary shot because you can see
Yep.
the sinus cavity on the top.
Is it a bite wing or a PA?
A PA.
PA.
Good. And what do you think this is right above the front teeth?
Your sinus cavity.
Okay, close. So everybody
Uh,
put your finger right above your
Oh,
What-
what's that?
Oh, it's
It's your nose. It's your nose. All right. So no, and I do this because this is what happens: is we get ultra focused, and we forget that the nose is in the front. All right. So I will never find a nose over. This is the nose bone. I'll never find a nose over my molars. Never.
right.
All right, because it doesn't belong over here, right? But I will find it right above the front teeth. And this is actually the septum in the middle of your nose that divides right and left. This is the floor of your nose right here. And these are the bones in your nose right here, these little round bones that are there.
Yeah.
So there you are.
Wow, I thought it was like
Yep.
from the bottom. You know how it splits like that as well,
Yeah.
kind of.
Yep. So this is, what do you think down there?
It's got premolars, so it's posterior molar.
Posterior. It has the premolar.
Premolar.
Yep. So this is a premolar. Do you think it's upper or lower?
Mandibular.
Good. Yep. So it's lower. And they're easy when they're mounted like this for you. It's when they're all turned around on a table that you might not be sure. You know? But you can see the abscess on this tooth, and you can see the very large decay here. And this tooth has to come out. This tooth cannot be saved. Yeah. So there's too much of it lost to fix.
Okay.
Yep.
They say no more than 3/4.
Yeah.
Right?
Yep. And then what about down here?
That's your anterior mandibular PA.
PA, beautiful. Yep. So, and because the teeth are so small on the mandible, you almost always see almost all 6 of them in each film. But what we're looking at is the anatomy below it to be sure that we've got everything there. So, good, nice job. All right, and those are on there for you if you need to. So, identification of the anatomy of each intraoral film is a skill you've got to have. So, we are not going to spend a lot of time on this tonight, but we will review it at some point. This is, and there's the link is right in the presentation. This is a link to identifying the structures on a film, because that is a huge part of RHS, is identifying what's there. Let me just make this bigger. Okay, so this PowerPoint here goes through it all very nicely to make sure that you know what you're looking at. And so we've got the pulp in the center of the tooth, we have the dentin around it, and then what's the white at the edge? That's the enamel, all right? And so each of these are labeled, and you can see them. Then we've got the alveolar crest. We have the lamina dura, which is hard bone that surrounds each tooth. That's the socket, all right? That's your tooth socket. So when someone has a tooth out and they say, oh, I got something stuck down in the socket, before it fills in, they're right down in there, right, where the tooth used to be. So that lamina dura, this bony socket, is the only thing protecting the bone after an extraction. And it shows that a little bit better, the periodontal ligament space, because remember, the ligament is what allows our tooth to kind of be cushioned each time we bite. And then it goes through each landmark, and it shows you a covered up landmark, or one that makes sure you know what it is that we're looking at, and then it shows you the landmark itself. And so that is the lingual foramen and genial tubercle, a nutrient canal, which is a strange thing, the mental ridge, the inferior border of the mandible, and then we can go on to the maxillary ones. What I want to, I'm just going through these fast because I want to show you one thing, because these there's just no substitute for time and going through them, because you learned your anatomy, but now you have to apply it to the x-ray. But what I wanted to show you was my favorite foramen, the mental foramen, all right, which I know we talked about when we were talking about our anatomy of the mandible, all right, and then the mandibular canal, which is where the nerve runs through the bone. A couple more there. Yep. And the inferior border of the mandible again. All right. Your coronoid process of the mandible. So all these things that we learned in anatomy are all coming back to haunt us with this.
Oh, yes.
All right. And there's the maxillary sinus,
Mm-hmm.
the zygomatic process of the maxilla. All right. And your zygomatic bone or your cheekbone.
Yep.
Right. Okay. So all of these things that we're going to look at, and we're not going to move on to panoramics yet. So that is part of what you want to go through as you're studying, is go back into this PowerPoint and click on the anatomy link here and go through them each one to study some more. There's a list in one of my PowerPoints that I'm going to put up there too of the ones you need to know. All right. So we are going to move on to not slide 24, because that's at the end, to part 2. Okay. And this is going to go a little bit faster because we've learned our basics. We've learned PA and bite wing. And we know a little bit about our anatomy, not a lot. And now we're going to put it all together. All right. So how do you take one of those PAs? How do you take one of those bite wings? That's what you want to know. All right. So identify the film type seen in this slide. Hint, there are only 2 types.
Right.
And the types are?
Periapical
Beautiful.
and bite wing.
Good. PA and bite wing. All right. And that you just want to keep telling yourself because that's what you got there. All right. You can also use vertical bite wings, but most only use those in periodontal practices or in practices where they see a lot of periodontal patients. Most people get horizontal bite wings, the other ones. All right. Okay. And just as a review to identify and compare. So what's different about the vertical bite wing versus the horizontal? It's the way that we hold the film. All right. So this one's vertical. That one's horizontal.
And it's the same.
Same
area.
Yeah, same area, same teeth, just different view. Yep. Okay. There we go. All right. We will talk about film next week. I'm not talking about it tonight. So film is a separate subject. Okay. So the 2 projections used intraorally for an FMX are periapical and bite wing. All right. Yes. Have I killed it enough? I think so.
Yeah.
Okay.
No.
And these projections are made with 2 types of techniques. So there are 2 ways to make a periapical and 2 ways to make, actually, there's only 1 way to make a bite wing. 2 ways to make a periapical, right? But basically, we have 2 techniques that we use to take x-rays. The paralleling technique is recommended because it supports ALARA. Can anybody tell me what ALARA is? I should have asked you that at the start of class when I was doing our questions.
As much as
As low as reasonably achievable. It is what we do to make sure that our patients get the least amount of radiation from any x-ray exposure and that we get the least amount of radiation from any x-ray exposure. All right. So which type of technique, just looking at this list of 2 techniques, which one should we do?
the first one.
The first one.
Parallel.
So, yeah. So you are always paralleling because it supports ALARA.
Okay.
Less radiation to the patient, and also it gives less distortion in the x-ray, which means that it's more true to life. It's not magnified or stretched out or but there are some times when you can't parallel. When can't you parallel? When you have a small mouth, a shallow palate, or tori. And I'm going to go through what those are. You get more radiation to the patient when you bisect the angle and more distortion. But sometimes you can't avoid it. Where did my tori go? Hold on. Don't look. I lost the tori. Okay. Ugh. Okay. Geometry review. Yay. No, not yay, right? Goes along with physics. Okay. So in order to learn how to take x-rays, you have to remember a couple things. Must be cold in here. All right. Parallel are two lines that will never cross. They run like this or like this, but they're never going to cross each other. Perpendicular is to make 90 degrees with something, or to make a T. All right, to come in and exactly make a T. Vertical is up and down, which we've already talked about. Horizontal is side to side with the horizon. And a bisector splits something into two equal halves.
Okay.
Splits it right down the middle. Okay, so these two vertical lines are parallel to each other. They can go on forever. I could keep drawing them off the page, but they're never going to cross each other
Okay.
because they're straight lines and they're like this, right? They can't curve.
No.
They're just straight. These two horizontal lines are parallel to each other. They're just with the horizon, right?
Right.
So it's either vertical or horizontal. And parallel are two lines that won't ever cross each other. The horizontal and the vertical lines are perpendicular to each other,
Okay.
meaning
Yep.
they make 90 degrees. They make a T
Yep.
if you put them together. Over here, these two lines are neither horizontal nor vertical. They're angled, and they're not parallel to each other. So you can easily see that those are going to cross, aren't they?
Mhm.
If I kept drawing either of those lines, they're going to cross each other.
Yes.
So they're not parallel lines.
Okay.
The dashed white line is a bisector. It splits them down the middle,
Yep.
equally in half. Okay, so your best practice is to parallel. This gives lower radiation to the patient. It is recommended by the American Dental Association, recommended by the American Association of Dental Schools, and recommended by the American Association or Academy of Oral and Maxillofacial Radiology. So everybody recommends paralleling. All right, what are the rules for paralleling? Number 1, place your film or sensor covering the right teeth. That should be a given, right? So you're not going to get front teeth if you place the sensor over here. Make sense?
Yeah.
Place it in the front. Okay. Position the film parallel to the entire tooth. All right. So your teeth on the upper head backwards at an angle. They head like towards your brain a little bit at an angle. So your teeth are angled like this. So your film should also be angled like this. So when a film is placed in the mouth, it's going to angle towards the back a little bit. And on the sides, it's going to do the same thing. It's going to angle towards the center, just a little. All right. The PID then should come in and make 90 degrees with the film. It should make a T with the film. The PID should be side to side, right looking at the teeth that you're going to take, or through the contacts. And then the PID should be long and cover the film completely. So, having said all that, now I'm going to say, or use a beam alignment device, which is a film holder with an liner on it, so that you don't have to think about these angles. All you have to do is place the bite block correctly. All right. So if you look at this list, you might think, how does anybody ever take an x-ray the right way? Right? This is how. Okay.
Yeah.
Now, I told you this last week. I call these idiot rings.
Yeah.
Not because we're idiots, but because if you can line up a circle to a circle, you should be able to get a good x-ray. All right. It is rare that you screw one up when you're using this. And the only time I've seen it done, and I've taught many labs on this. I wish we could all be together in a lab because we'd have so much fun together. But if I've taught many labs on this, if you don't set this instrument up the right way, it won't do what you want it to do. Okay. So you got to know how to set it up, and then you place it, and it should do its thing. All right. What is it called? The most common name for this is RIN. So we say, go get the RIN, the RIN's the best way to take this. I need a red RIN, I need a yellow RIN, I need a blue RIN. So RIN is the name. And XCP stands for Extension Cone Paralleling, which is 16 inches long paralleling. Cone is your PID. All right? So XCP just tells us what we're doing.
Can you tell me what PID is?
Yeah, PID is your position indicating device.
Okay.
It's the round part of the x-ray that points at the patient.
Okay.
There it is. This is PID.
Okay.
Yep. So you can see what a RIN does. Once it's placed in the mouth, you need to take your PID and line up circle to circle.
I've had one of those done.
Yeah.
Yep.
Yep. And what it's doing, because you do have to know what it's doing for the RHS exam, it is making sure, and if you look at this down here, I don't want to go too far because my thing will come on and cover it up. It is making sure that the film is parallel to the tooth and the beam makes 90 degrees with the film.
Okay.
So when you parallel, what's parallel? The film is to the tooth. What's perpendicular? The beam, the x-ray beam coming in. So if this is my film and my x-ray beam comes in like this, is it making a T?
Yeah.
It's more like a L or an angle. It has to be straight 90 degrees. Yep.
Okay.
Perpendicular to it. So this is why we use these aligners, because that's what helps it to do that.
Mm-hmm.
All right. So here are the parts of the RIN, and they are color-coded. The parts of the RIN are the plastic bite block and backing plate. Say that 5 times fast. So here is the bite block right here and the backing plate right there. And then we've got a metal arm that connects to it and a positioning ring. All right. And so this is the way it goes together. We've got positioning ring, bite block, backing plate with the film, and the metal arm connects them all together. Mm-hmm. All right. How I like to talk about this is SOF. Source of the x-ray. Object, which is the tooth, and film, F. SOF. So you always got to have your SOF. You can't take it out of line. So if the film is in front of the tooth, are you going to get an x-ray? No. Film's going to be behind the tooth.
Right.
All right? So you're making shadows, basically. You have to have this all in the right line. All right? So the film or the sensor is placed inside a RIN. It's placed with the white side or the colored solid side towards the source of the radiation. So we say white in sight. Make sure you can see the white. Mm-hmm. And then if you're using film, there's an orientation slot, dot on the on the film, and we say dot has to go in the slot. And that's something that's hard to do without showing it. But when we talk about film next week, you're going to see what the dot is, and I'll make sure that makes sense. All right. So color coded. Red is for bite wing. Yellow is for posterior PA. Blue is for anterior PA. Somebody got smart, and they made them all in one.
Wow.
Isn't that cute?
It is.
All right. So all you have to do is keep taking the ring off and putting it through the correct color, depending on what you're doing. And a lot of offices that are using these universals, these all-in-ones, because it cuts down on the number of instruments they have to buy. So, and then if you see a green one is for root canal. It's got a little ramp on it that the patient can bite on, which is advanced radiography that will make you cry. So I actually had the opportunity to go and observe a former student of mine. She was a graduate, and she was taking a root canal, an x-ray on someone who was having a root canal. Literally 10 x-rays later, she finally got the film. And I'm standing there behind her, and I'm like, no, do this, do that. And she's like, oh. It was very stressful for her. But those are hard films to take. All right, so Note the film position in the bite block. It is vertical when you are taking anteriors. How do I know it's an anterior? Because it's blue. It is horizontal when you're taking posteriors. And I know it's posterior because it's yellow. All right, so these are the color codes. The yellow rins, the posterior rins, have to be flipped so that they can work on the correct side of the mouth. And so the A and E, these two right here, are mirror images of each other.
Yeah.
And they will work for the top right and the bottom left.
Okay.
B and D will work for the top left and the bottom right. So when you take the top right, the most logical thing to do is to then use the same instrument and take the bottom left, right? Which is what we do. So we do, and then I can turn my Rin, flip it around, and take the other side. And this is definitely a hands-on thing. It is unlikely that you will be asked a question about flipping the Rin on RHS, but you want to have a really good handle on the colors and the positioning of the film. All right. Okay, so that's for paralleling. So paralleling, easy. Just use the idiot ring, right?
Bite block.
Yep. Bite block, backing plate, and aiming ring. Bisecting angle is the other technique. And this is when you can't use that Rin. You may have to do it this way. This is old school.
Yeah.
This is the way I learned to take x-rays because Rins were not in fashion then, which was 30 years ago. So some of you have not been alive that long. I'm aware of that. Small mouths, shallow palates, and tori. So this patient right here has tori.
What is it?
Tori are bumps of bone that are normal. So some people have them and some people don't, but they're normal. So my husband has these. He's got these down here, and he's got one on the roof of his mouth. And they're normal, just extra pieces of bone that some people have.
Okay.
But not everyone has them. So when you look into a mouth and you see tori, you go, ugh. Because you know you're going to have to, most likely, use a different technique to get the correct film. All right.
Okay.
So you will not know you have these unless someone has told you, a dentist or a dental professional has told you you have them, because to you they feel normal, right? So you can kind of feel around now and see if you've got them. You may want to look in the mirror later. But remember, we only do this technique because we can't do it the better way, which is paralleling. All right. Bisecting the angle is typically done with a short cone, meaning 8 inches, which is why there's more radiation to the patient, because it's closer to the patient's face. It's always done with a size 2 film, and you have to figure out the angle, horizontal and vertical. So this is how it's done. So you are aiming at the patient without a ring, and you have to know exactly in the mouth where that film sits and how much angle you need on your PID. It's very difficult. All right, it's not. It doesn't come easy. I guess it takes some practice. So, vertical angulation. Remember, are these numbers on the tube head here?
Okay.
In degrees. Remember, if the tube head is flat, we're at 0. And what is it if it's pointing down?
Positive.
And what if it's pointing up?
Negative.
Negative. Okay, so pointing down is positive, pointing up is negative. I won't get over it. It's going to take me like therapy in at least a week before I get over that. So, therapy being a glass of wine, probably. You know, I mean, I'm not being too serious now. All right, so the vertical has to be either pointed down at a positive, pointed up at a negative. See, I can write it correctly. If you're off on your vertical, you are either going to squish the tooth, which is called foreshortening, or you're going to stretch the tooth out, which is called elongation. Not literally, but
Oh, that's
in
what I
your
thought.
x-ray. Yes. So basically, remember you're casting shadows when you're using an x-ray beam.
Mm-hmm.
Did anybody do that with the flashlight, actually? No, I didn't think so. But
What did you? Oh, you said.
yeah, so if you do the rabbit on the wall thing, did you, Sarah, did you do it?
Yes.
All right. I love you.
Yeah, with my daughter. We had fun with it in her playroom.
That's awesome. Yes, if you have children, you have to do this, all right? Because
Yes.
they'll love it. Yeah, and you might even learn something. Yes. So I have a mnemonic for this. Remember, a mnemonic is something that has nothing to do with the topic, but just helps me to remember how it goes. And apparently, I know now I need a mnemonic for my vertical angle. So if your angle is too steep when you aim it at the patient, so let's say you're supposed to be here, but you come in really high like that's too steep. You're going to get foreshortening, and so I say overangulation causes foreshortening, so I make a word out of it. It's of.
Okay.
Underangulation, being not steep enough, too flat, will cause elongation on the x-ray. And I can't make a word out of it, so I know they go together.
Yui.
Yeah, you.
Yui.
Yep, right, exactly. Yui. So whatever works for you to remember the way that these two, some people can do it by memorizing the fact that when the sun is high in the sky, like at noontime, your shadow's really short. And then later in the day, your shadow's really long.
Yeah.
So they say that underangulation, as the sun sets, your shadow gets longer, right? So that means your angle's too low. And so some people can do it that way by using the sun. That always got me confused. But I can do it this way. And then horizontal is your side-to-side direction of the PID. And that has to go right through the contacts of the teeth. So what that means is that if these are teeth, if I'm not aiming right at them, let's say I'm aiming like from the side, then I'm going to get something I don't want to see. I want to see them right dead on. All right. So here is what overangulation looks like. And you can see that the green arrow up here is how it should look. So this is the way this x-ray was taken, which is with too much angle. So if I want to, if I want to correct it, I need to come in with a new film and put my angle down a little bit. Because what happened to these teeth, they look like somebody squashed them.
Oh. Okay.
That's too short. Those teeth are too short. They should be longer than that. And if the edge of the crown is cut off, that's how you know you've done it too.
Okay.
All right. And where did the other one go? Okay. Went too fast. Guess this one didn't have its delay on there. So obviously this one, those teeth are stretched out. They're too long. And this one is easier to identify, I think. But so the angle that the x-ray was taken with was too flat. So we came in and we made it a little steeper, and that's how we correct it. All right? So the roots may be cut off, and the tip of the root might be cut off there. Okay. So there are a ton of errors you can make, obviously. That's probably the biggest. A very large part of RHS is on the errors. And so I've put a couple of them on here just for us to get used to sort of thinking about it. But I have, as usual, a link to another presentation with errors that you can quiz yourself on. All right?
Nice.
Yeah. So this is improper placement. The film was put in the wrong place. You should see that. You've got the roots. You can't see them there. And this has too much black at the top of it. All right. So most of the time, this is because the patient doesn't bite down all the way on the bite block. So they call it improper placement because we're supposed to make sure they are biting all the way. Why don't they bite all the way? Because it hurts.
Oh.
So X-rays are not always comfortable. And if you've had a few taken, you might know this. And you do have to coach your patient. which is why you are running for that sensor button as soon as you get them in the right position, because you don't want them to move. You want them to stay still so you can catch that. This is called a cone cut. This is when your cone, or your PID, is not lined up with the film. And some of the x-ray doesn't get exposed. So what does it look like? It's white. It's usually round.
Cool.
And there's another one here. This is rounded and all blocked out white up at the top. This is a bent film. So the film is in the patient's mouth, but it's like squashed. And this is a patient moving during the x-ray.
Oh,
And
yeah.
it's all blurry. Overlap is due to not being dead on with your x-ray. Overlap means you came in from this side or that side to the teeth. So overlapped is incorrect horizontal from side to side. And we've got to correct that by retaking the film with the correct horizontal. For me, this was my error that I made a lot when I first started taking x-rays, was I wasn't sure how to do my side to side. I could get my angles okay, but my side to side was difficult. So everybody has a little glitch that they're going to find out about as you start to take films, and that's normal. It's okay. So if you're looking at this feeling like, I'll never be, yes, you will. Because you will. So this one has the wrong teeth in the film. So if you notice, the first premolar is not visible here. So this is wrong teeth. And this one's a phalangioma. Yes, which is a word meaning the finger of the patient is visible on the x-ray. So this is why we don't want our patients to hold the film, is because their fingers then get in the x-ray. So that's more exposure to their finger, and also I've got a bone here that doesn't belong, right?
Yeah.
So
I can't see it.
yeah. All right. So some other, yep.
Oh, so I know when I go in for my x-rays, they have a really hard time. I have an extreme open bite.
Yes.
So they have me in some really strange positions.
Yep.
It's interesting.
That's a lot of fun, Court.
Yeah, I'm just used to it now.
Yeah, exactly. Cotton rolls for you, my friend. Yep. So styrofoam, stabies, snap arrays, easy grips, alligators, that's what all these things are often called, are other film holders. And you notice that none of these have the beam alignment device. So they're all going to require us to know our vertical and know our horizontal. And that's difficult. All right. So these are the ones that take a lot of practice. Okay. Bite wings, thankfully, are always parallel. That's just the way that they work. And your horizontal needs to go through the curve of the arch. Again, that side to side thing. And then the vertical should be plus 10. So pointing down slightly. All right, just a little bit, plus 10. And so in most adults, you can't be through the contacts on the molars and the premolars at the very same time. So you need 2 bite wings on each side. So that, like, if your horizontal could be correct for both premolars and molars, you might only need 1. But because to be through the premolars, you got to have 1 here. And then your horizontal is going to change. It's going to go through here.
Yeah.
So you've got to move it. You want it here and then here to the back. So this is why we take 2 on each side on adults, because otherwise we get overlap of the teeth. And then we can't see the little changes in between. So if this is overlapped on each other, I would never see that the patient is starting to get a cavity right here.
Proximal.
Yep, good, very nice. So she said proximal surface, and that's exactly what we want to see. And then the film is parallel to the crowns of the teeth. It's always parallel. All right. Use the RIN. That's the best way to get the best bite wing. Bite wings are always taken using the parallel technique, and your angle is going to be plus 10, but the RIN will set this all up for you, so you don't have to do it. And this just shows a close-up of how that looks in the mouth, and then the film that we get from it.
So is it the patient's bite that holds it there,
Yes. Yep. And that's true
right?
with
That
all of
angles
them.
it for
Mhm.
you?
The way that the metal arm and the ring are set up is what gives the angle,
Okay,
and then the patient's bite holds it steady.
good.
Yep.
Okay.
If you're using a tab, which some of you may have had the tabs taken before, that requires you to know that you need that +10, that downward angle, and to get the correct horizontal. That is a harder way to do it, but it is sometimes more comfortable for the patient, and it may be the way that you eventually get used to it. So you'll see older hygienists do this all the time. Younger ones do this. Why? Because these are what most people are trained with these days. I was trained with one of these. But if you give me the choice, I'll use this every time. Because that old way is no good. All right. So how do you prepare your patient for films? Review the medical history. Explain the procedure. Ask if the patient has any questions. You can and probably should ask women of childbearing age if they're pregnant. We don't change our techniques for pregnant patients, but we may delay the films until they deliver if they're not absolutely necessary. The problem is you don't want to have dental disease when you're pregnant either, so you're going to want to leave that decision up to the dentist. You're going to go back and you're going to say, so-and-so in room 2 is pregnant. Do you want to come and talk to her about the x-rays? Right? So you don't want the patient to have anything foreign in their mouth. Remove chewing gum, piercings, partials, dentures, eyeglasses, especially piercings, definitely. And then the chair should be positioned so that they're mid-sagittal, they're straight down the middle, is perpendicular to the floor. All right, so you don't want them like this. You don't want them like that. No Valley Girls. And you want to be sure that their upper arch is parallel to the floor. All right, so you don't want them like that, and you don't want them too high up either. So you want the upper arch to make a parallel with the floor, like this, and you want the midline to make a perpendicular with the floor. All right, and that's how you know your patient is set up correctly. And then you place the lead apron with a thyroid collar, and you go to town. All right, how many, or how do you go to town? A lovely table that I've made for you. Yellow posterior periapicals, 8 of them, 2 on each side, upper, and 2 on each side lower. So that's 4 on each side, makes 8. Bite wings, how many? 4 of them, 2 on each side. Anterior is the place that it will vary. So the others never vary. We need those 12 films all the time, the 8 and the 4. But the anterior will vary, meaning that if I use a smaller film, I need more shots. So if I'm using a size 1, I can take 4 uppers and 4 lowers, or I can take 4 uppers and 3 lowers, and that's all going to depend on the dentist preference, the patient's anatomy, and sometimes what you have available for film. All right, so if you're using a size 2, you only need 6 of them, and that's 3 upper and 3 lower. Okay. You always do this in the same way every time so that you don't miss any. So if you start at the same place and end at the same place every time you do it, you will take the correct films. If you start moving around, you're going to miss them. You're going to forget that you took one, or you're going to skip one. So you'll get doubles or skips, and that's not good. If you're using a computer, you can see. Visually, the film comes up in 30 seconds. You can see it right there. So you don't have to think as hard. But if you're using film, you should always take it in the same order. What order? This order. Upper right canine. Upper centrals. Upper left canine. Lower left canine. Lower centrals. Lower right canine. All right. Then I'm done with my blue instrument. And I move to 7 and 8, which is top right premolar molar. 9, 10, bottom left premolar molar. 11, 12, upper left premolar molar. 13, 14, lower right premolar molar, and then I take my bite wings and I go right and left.
And they're all symmetrical.
Yep.
The
Yep.
numbers
Yeah.
too.
Yep. So it is the best way. It takes less energy to do it this way because you're going in a certain order. So I usually say make a box in the front and an X in the back. All right.
Yeah.
And then your bite wings are not as you can do your bite wings really in any sequence that makes you happy. There's only 4 of them as long as you're doing the right ones. But I do mine this way. So, so this is all color coded and would be a very good idea to begin practicing what we call these. So this is an upper right canine periapical, upper central and lateral periapical. All right. So as you go through, just practice saying the names. Okay. These are just some guidelines, things we've already done. Makes more sense when you're actually doing it, but it is in the text and I wanted to pull it out. Sometimes those boxes and tables, we don't always read them, but they're important. Yeah.
They're easy to skip.
Yes, they are, and they're very important. So
I know.
I like to pull them out when I can. All right. The last thing is putting the puzzle together, arranging them in anatomic order so that they make sense. So we label them with the patient name and the date of exposure. If you're in a computer, that's all done for you. If you're in a computer, you can program it to mount them in the order you take them. So that's an easy thing. But if you're using film, it's fun. All right. I have 2 things up here. On Evolve, if you go into the interactive dental office, there is a place to practice mounting your sets of x-rays. You've
Really?
got to do this. Yep. So
Nice.
there is also an awesome app if you're an iPhone or iPad or I guess probably even Android too user. I don't know. I'm an I person. So the University of Toronto has an app called Set Up My FMS. So if you go to the App Store and you type this in, you will get this app, and it is fantastic. It like is so much fun. Yeah, it's like putting together puzzles, except they're of the mouth.
I don't have an ice.
I know, they're so much fun. I know, but the one on Evolve is good.
Okay, good.
So when you mount, the bubble is always towards you, and we'll talk about the bubble next week. Decide if it's PA or bite wing. Decide if it's upper or lower. You've got to use your anatomy for this. Upper anteriors are bigger than lower anteriors. They're wider. So that's one way I can know. I can sometimes see the nose in the film. That's another way I can know because you don't have a nose down here.
Right.
Lower molars have 2 roots. Upper molars have 3 roots. Upper first premolar always has 2 roots. Rest of them, most of the time, 1. So it's an easy thing to see. Decide right or left, which is more mesial. All right, so you want to decide whether it's the right side or the left side, and then mount it on. All right, and this is what you can use as a template to sort of see how you're doing. Those apps and the Evolve resources will teach you tons about doing this, and they're fun because they're computer game like. All right. So the very last part of tonight's lesson is just what should be visible on the full set of x-rays. So for each film in order, it shows what needs to be in that film. And so this is the canine film. This is what needs to be in it.
Okay.
All right. So this is what tells you how to place this in the mouth to get what you need. So this is a pretty cool little collection here.
Nice.
And centrals and laterals, all right? And so you can just keep going through here, and it's all done in sequence, in that sequence that I gave you on the right way to do it. And remember that it's a mirror image, so that what you do on one side, you're doing on the other, just backwards. All right. And so the views are all the same. You've got to have it, whether you're using film or digital, you want to make sure that the area is still visible. Okay. Do we have questions? How we doing?
I'm excited about it.
Okay.
Good.
Yeah.
Thank you. I love it when people talk to me. So it's, that's why I stretched this over 3 weeks, because there just is really a lot to absorb.
Yeah.
All right. So while the lesson tonight is a little shorter than the other lessons that we've done, it's because we're drawing on the anatomy that we learned before. So I would like you to use the extra time, all 20 minutes that I've given you. You don't have to do it now. What I'm saying is that, the condensed lesson tonight is a reflection of how much time you're going to need to put in to refresh yourself of the skills, all right, of using the anatomy to identify these x-rays. So make sure you get on Evolve and do at least one full set of x-rays, if not more. Practice mounting them. And then do the anatomy PowerPoint that is linked to this one, okay? And those I'm going to put up. They'll be up by tomorrow morning on there, okay? Or early tomorrow morning, most likely, because does anybody need them tonight? Is anybody burning to have them tonight? I'll have them on tomorrow morning.
Thank you.
Yeah. So this concludes your week 8.
Really?
Yes.
2 more weeks?
Yep. You get out of jail free tonight for a little bit.
Thank you.
Yeah, I know. I know it's not much. It's only a few minutes, but
Still good.
does anybody have any questions about the Dale Foundation, about RHS, about anything?
The Dale Foundation.
Yes. No.
What?
That's the online study that you're going to have access to.
Okay.
I'm waiting until your exams are finished to get you
okay.
access to that, but I will get everybody signed up for that. But I don't want you to have access to it when you have other exams to do, because there's only so many hours in the day,
Right.
So have a great night, everybody. Enjoy. And yes, we have class next week, and that's our last one until January. Okay, so see you
Okay.
guys next week.
All right. Bye, Kelly. Have a good night.
Bye. Bye. Hey, Liza. Miss Liza. Oh, thanks. Yes. You should be all set. Then.
I am too, yeah.
Okay, you got it. You got back in.
Yes, thank you so much.
No problem. Have a great night.
You too.